Shock NCLEX questions. Question 1. A patient is admitted to the emergency department after sustaining abdominal injuries and a broken femur from a motor vehicle accident. The patient is pale, diaphoretic, and is not talking coherently. Vital signs upon admission are temperature 98 degrees Fahrenheit, heart rate 130 beats per minute, respiratory rate 34 breaths per minute, and blood pressure 50/40 millimeters of mercury. Which type of shock does the healthcare provider suspect? Hypovolemic, cardiogenic, neurogenic, distributive. The patient shows signs of significant blood loss and clinical symptoms of shock, such as tachycardia, tachypnea, and severe hypotension, which are characteristic of hypovolemic shock following trauma. Question 2. A patient with pericarditis related to radiation therapy becomes dyspneic and has a rapid, weak pulse. Heart sounds are muffled, and a 12 mm of mercury drop in blood pressure is noted on inspiration. The healthcare provider's interventions are aimed at preventing which type of shock? Distributive, neurogenic, obstructive, cardiogenic. Obstructive shock can be caused by anything that impedes the heart's ability to contract and pump blood around the body, as seen with cardiac tamponade. Question 3. The healthcare provider is caring for a patient who has septic shock. Which of these should the healthcare provider administer to the patient first? Antibiotics to treat the underlying infection, corticosteroids to reduce inflammation, intravenous fluids to increase intravascular volume, vasopressors to increase blood pressure. Circulation and perfusion are addressed first, so intravenous fluids will be started immediately. After blood cultures are obtained, broad-spectrum antibiotics should be administered. Vasopressors are used if the patient does not respond to fluids. Question 4. A 4.5 kilogram infant is admitted to the pediatric intensive care unit after 33 days of watery diarrhea. The infant is diagnosed with severe dehydration, with mottled skin, poor turgor, delayed capillary refill, and an absence of tears. Which intervention should be the priority action? Calculate the mean arterial pressure. Draw blood for a complete blood count. Establish vascular access. Take a complete set of vital signs. Vascular access should be established quickly in order to replace lost volume before shock progresses. Question 5. Which of the following assessment findings is an early indication of hypovolemic shock? Diminished bowel sounds, increased urinary output, tachycardia, hypertension. Tachycardia is an early symptom as the body compensates for a declining blood pressure by increasing the heart rate to circulate blood faster and prevent tissue hypoxia. Question 6. When compensatory mechanisms for hypovolemic shock are activated, the nurse would expect which two patient findings to normalize? Intensity of peripheral pulses and body temperature, peripheral pulses and heart rate, metabolic alkalosis and oxygen saturation, cardiac output and blood pressure. The goal of compensatory mechanisms is to maintain cardiac output and blood pressure to ensure adequate tissue perfusion. Question 7. Which type of fluid is most appropriate for volume replacement for a patient with non-hemorrhagic hypovolemic shock? Lactate ringers, 10% dextrose in water, 1/2 normal saline, packed red blood cells. Lactate ringers is an isotonic crystalloid often used for fluid resuscitation in patients with non-hemorrhagic shock. Question 8. A client has been diagnosed with sepsis. Which assessment finding would the nurse most likely expect to find in this client? Rapid shallow respirations, severe hypertension, increased appetite, bradycardia. Sepsis often presents with rapid, shallow respirations as part of the systemic inflammatory response. Question 9. A client in shock is prescribed an inotropic drug to act on alpha and beta receptors. Which medication will the nurse most likely be administering? Dopamine, dobutamine, pavilon, milrinone. Dopamine is an inotropic drug that acts on alpha and beta receptors depending on the dosage. Question 10. The client experiences shock following a spinal cord injury. This type of shock is classified as which of the following? Hypovolemic, neurogenic, cardiogenic, anaphylactic. Neurogenic shock occurs due to the loss of sympathetic tone following a spinal cord injury. Question 11. The client in shock is prescribed an infusion of lactate Ringer's solution. The nurse recognizes that the function of this fluid in the treatment of shock is to do which of the following? Replace fluid and promote urine output. Draw water into cells. Draw water from cells to blood vessels. Maintain vascular volume. Lactate Ringer's is used to replace intravascular volume and help maintain renal perfusion, which promotes urine output. Question 12. Dobutamine is used to treat a client experiencing cardiogenic shock. Which nursing intervention should be included in the care plan? Monitoring for fluid overload. Monitoring for cardiac dysrhythmias. Monitoring respiratory status. Monitoring for hypotension. Dobutamine increases heart contractility but has the potential to cause cardiac dysrhythmias. Question 13. Which predisposing factor would a nurse expect to find in a patient with septic shock? A 45-year-old client with a history of renal insufficiency. A 65-year-old client with cancer recovering from an abdominal peritoneal resection. A 27-year-old with pyelonephritis responding to antibiotic treatment. A 50-year-old with community-acquired tuberculosis. Advanced age, immunosuppression from cancer, and major surgery are significant risk factors for developing sepsis. Question 14. Which of the following statements best describes the management of multiple organ dysfunction syndrome? Using proton pump inhibitors to increase stomach pH. Maintaining specific ventilator settings for tidal volume. There are no specific therapies other than supportive care and early recognition. Organ damage is mainly associated with pre-existing conditions. The management of multiple organ dysfunction syndrome is primarily supportive, focusing on the early recognition of failing organs. Question 15. All of the following statements concerning disseminated intravascular coagulation are true except which one? The rapidity of onset is determined by the intensity of the trigger. In the early phase, the patient may show manifestations of thrombosis. Excessive blood loss rarely results in hemorrhagic shock. The most critical intervention is treating the underlying disorder. In disseminated intravascular coagulation, excessive blood loss can and often does result in hemorrhagic shock due to the depletion of clotting factors. Question 16. A patient is treated in the emergency department for shock of unknown origin. What should be the first action by the nurse? Check the blood pressure. Obtain an oxygen saturation. Attach a cardiac monitor. Check level of consciousness. Airway and ventilation are prioritized first according to the ABCs, so oxygen saturation is determined and addressed immediately. Question 17. A patient with hypovolemic shock has a urinary output of 15 milliliters per hour. Which compensatory physiologic mechanism leads to this altered urinary output? Activation of the sympathetic nervous system causing renal artery vasodilation. Stimulation of cardiac beta-adrenergic receptors. Release of aldosterone and antidiuretic hormone. Movement of interstitial fluid to the intravascular space. The release of aldosterone and antidiuretic hormone increases the reabsorption of sodium and water, leading to decreased urine output. Question 18. While caring for a seriously ill patient, the nurse determines that the patient may be in the compensatory stage of shock based on which finding? Cold, mottled extremities, restlessness and apprehension, a heart rate of 120 and cool, clammy skin, systolic blood pressure less than 90 millimeters of mercury. Restlessness and apprehension are early clinical signs typical of the compensatory stage of shock. Question 19. When assessing hemodynamic information for a patient in shock of unknown origin, when would the nurse anticipate the administration of large volumes of crystalloids? Cardiac output is increased and central venous pressure is low. Pulmonary artery wedge pressure is increased and urine output is low. Heart rate is decreased and systemic vascular resistance is low. Cardiac output is decreased and pulmonary artery wedge pressure is high. A high cardiac output and low central venous pressure are suggestive of septic shock, which requires massive fluid replacement. Question 20. A patient with massive trauma and possible spinal cord injury is admitted. Based on which finding would the nurse suspect neurogenic shock in addition to hypovolemic shock? Cool, clammy skin, shortness of breath, heart rate of 48 beats per minute, blood pressure of 82/40 millimeters of mercury. Bradycardia in the presence of hypotension suggests neurogenic shock because the normal sympathetic response to shock is tachycardia. Question 21. A patient in septic shock has not responded to fluid resuscitation. Which medication does the nurse anticipate administering next? Nitroglycerin, dobutamine, norepinephrine, sodium nitroprusside. Norepinephrine is a vasopressor used to increase systemic vascular resistance and improve blood pressure when fluid resuscitation is unsuccessful. Question 22. Which action should the nurse include in the plan of care to best prevent shock and multi-organ dysfunction syndrome in a dehydrated patient receiving chemotherapy? Administer all medications through an indwelling central line. Place the patient in a private room. Restrict the patient to well-cooked or processed foods. Insert a nasogastric tube for enteral feeding. Placing an immunocompromised chemotherapy patient in a private room reduces exposure to pathogens and decreases the risk of sepsis. Question 23. A patient with cardiogenic shock has a blood pressure of 86/50, a pulse of 126, and an elevated pulmonary artery wedge pressure. Which intervention will the nurse anticipate? Administration of intravenous furosemide, titration of an epinephrine drip, administration of a normal saline bolus, assisting with endotracheal intubation. Elevated pulmonary artery wedge pressure indicates high preload, so furosemide is used to reduce fluid volume and improve cardiac output. Question 24. Which information indicates that a patient with septic shock is still in the compensatory stage? The cardiac output is elevated. The central venous pressure is increased. The systemic vascular resistance is high. The pulmonary artery wedge pressure is high. In the earlier compensatory stage of septic shock, the cardiac output is typically elevated. Question 25. To monitor a patient with severe acute pancreatitis for early organ damage associated with multiple organ dysfunction syndrome, which assessment is most important? Stool guaiac and bowel sounds, lung sounds and oxygenation status, serum creatinine and urinary output, serum bilirubin levels and skin color. The respiratory system is usually the first to show signs of multiple organ dysfunction syndrome due to the direct effect of inflammatory mediators. Question 26. When caring for a patient with septic shock, which assessment finding is of greatest concern to the nurse? Blood pressure of 88/56, apical pulse of 110, urine output of 15 milliliters for 2 hours, arterial oxygen saturation of 90%. Low urine output indicates inadequate renal perfusion and suggests the patient is progressing into a more severe stage of shock.